Good evening. Welcome to this edition of the 411 Talk Zone radio show. My name is Leon Jones. Tonight's topic, the title is going to be a question. What is a personality disorder? Now, I've done videos giving overviews of the types of personality disorders, but do you really know what a personality disorder is? Because a common and proper characterization of a personal disorder is that anyone who struggles with an unpleasant personality has a personality disorder. However, that is far from the truth. Personality disorders refer to a series of mental health illnesses that relate to the inability to perceive and relate accurately to people and situations. Now, this disorder can impact an individual's ability to interact with others and the world. While personality disorders include a range of the most common symptoms that involve or include frequent mood swings, social isolation, raging outbursts, general paranoia, difficulty in making friends, poor impulse control, and addiction. It is not uncommon for a personality disorder to coexist with other illnesses like depression and impulse control. Now, currently, there are a set of manuals out. The newest one is the DSM-5. Now, the DSM-4, which is the Diagnostic and Statistical Manual, 4th edition at that time, listed 10 personality traits that were grouped within 3 different clusters. I believe that the DSM-5, the later edition, that does the same thing, because when it comes to these clusters of personality disorders, they are very unique. Now, they're labeled A, B, and C. When you deal with cluster A, those are odd or eccentric disorders and fears of social relation. Under cluster A, you have the paranoid personality disorder. That's irrational experiences. I shouldn't say experiences. Let me use a better word. Irrational suspicions and mistrust of others. Then you have the schizoid personality disorder, which that's basically a lack of interest in social relationships. Then you have a schizotypal personality disorder, and that's when behavior is very odd and the thinking is very odd. Now, under cluster B, the personality disorders become a little bit more dramatic, emotional, and erratic. Now, under cluster B, you have the antisocial personality disorder, and this is where a person with this disorder will show a lack of empathy and a pattern of criminal activity. Then you have the borderline personality disorder, basically black and white thinking impulsively, and their behaviors that lead to self-destruction or self-harm. And you have the histrionic personality disorder. And this is a disorder where an individual is seeking attention. In other words, if they have sexual behavior, it's going to be promiscuous. Other words, it's going to be inappropriate, seductive behavior, and the emotions are going to be exaggerated as well. And then I call this one the big one, the granddaddy of them all, the narcissistic personality, because with that, there's also grandiose behavior, extreme levels of jealousy and arrogance. And then under cluster C, this is when these personality disorders have a vibe of anxiety and fear. So I'd say they are anxious or fearful disorders. This is where you have the avoidant personality disorder, feelings of social inadequacy, avoidance of social interaction. In this disorder, this is where an individual wants to be a loner. Then you have the dependent personality disorder, which is a psychological dependence on other people. In other words, a person with this disorder really believes he or she can't do for themselves. They need other people, and they lack self-esteem and self-confidence. Then there's the OCPD. Now, I'm not going to lie. I had some of this disorder because I was a drill sergeant in the military. And I am a big stickler to rules and regulations, and sometimes I tend to be a little stubborn and inflexible. But I've learned how to step back and actually observe issues with a more rational approach, such as being a little more professional. I don't have to be as rigid because if I'm rigid, my blood pressure tends to rise. And what happens? That'll lead me to the heart attack and a stroke, and it could lead me to an early grave. Now, when somebody has an obsessive compulsory personality disorder, they're basically utilizing a rigid conformity to rules, moral codes, and orderliness. They tend to be perfectionists. Although I was never a perfectionist, I did stick a lot to order because I believe structure is how you get things done. Chaos doesn't get anything done. It just confuses everything. But you have to have a balance. And that's how you deal with being rigid. You don't necessarily have to follow the rule to the T because all rules are utilized as guidelines. So to avoid the high blood pressure or the possible stroke, you don't have to be rigid in your thinking, but you do have to be balanced. That has to do with being flexible and inflexible, and that's based on the situation. Now, it's also important to note that an obsessive compulsive disorder, which is OCD, is not a personality disorder. It is an anxiety disorder. And basically, when somebody is compulsive or they have an obsessive compulsion for something like shopping, and I did a video on that, they have an addiction to shopping. That's when somebody is obsessive to doing something that they feel is going to make them feel good at that time. Now, when it comes to any disorders, what type of therapy do you need? Because I can put out the word all day, well, you need therapy, you need medicine. Well, personally, disorders generally involve a number of individuals that include a family doctor, therapist, and a psychotherapist if the situation is severe and you need a support network. Now, psychotherapy is typically combined with abnormal behavioral and cognitive behavioral therapy known as CBT to provide a dual approach that will result in more efficient treatment. However, the precise method will depend on the severity of the disorder. In some cases, hospitalization may be necessary. Within initial treatments, it is uncommon for medication to be prescribed because there is no specific medications prepared for individuals suffering from personality disorder symptoms, but antidepressants, mood stabilizers, and anti-anxiety medications, they're very common. Treatments almost always involve psychotherapy, or we can call it talk therapy, put that in layman terms. From there, the therapist will diagnose the actual issue and personality disorder so treatment can progress. That being said, why should you really hire a therapist? And what do you need to know about a therapist? Because personality disorders can result in a significantly diminished lifestyle and a host of other problems. They can interfere with your ability to develop friendships, advance in your career, and may even lead to decisions detrimental to your health and well-being. So an individual who starts experiencing chronic symptoms of any disorders should seek out assistance as soon as possible. If this is not sufficient to persuade individuals to visit a therapist, then it will generally occur after an intervention or when the personality disorder interferes with his or her life. And at the end of the day, when that happens, they won't be able to function properly in life. Now, some of the symptoms that cause the most concern are pairing, such as general paranoia and difficulty in making friends. Now, it is not uncommon for individuals to actually go to a therapist for something such as an addiction or poor impulse control, and then later discover that larger issues are involved. Now, individuals struggling with these issues are generally loath to seek aid from a therapist. Friends and family cannot force them to seek help unless the harm is so great that it results in hospitalization. So, when it comes to a therapist, when dealing with any type of disorders, like I said, you generally work with an abnormal behavior or cognitive behavioral type of therapist. Now, remember something, therapists are human beings and they make mistakes as well. So, due to an inability to perceive accurately, you will not be able to rely on how you feel about the therapist. Now, to find one, it's best to take the advice and recommendations of others to whom you trust. The process of addressing the inabilities you may perceive could be uncomfortable, but they are necessary. The specialization is the real key. And if you're able to find somebody who specializes in, say, schizotypal personality disorder, then it's best to go with that specialist rather than someone who is general. Now, again, with these personality disorders, it is very important to know that there are 10 of them. And a number of us have experienced them. We may not know it, but in the future, I'm going to do videos and I'm going to break down the characteristics under all 10 of them so you know exactly what's in these personality disorders, because some may have one trait within a disorder, some may have two traits, some may even have three, and some may even have a couple of disorders. And the ones that I know that are very common are narcissism and, of course, paranoia. A number of people have those two issues because when it comes to narcissism, particularly in the African American community, and the reason why I can say this, because many in the African American community are very envious and jealous of each other. No matter what someone else does, another black is always trying to attack the black trying to do something for himself. Why? Because number one, a number of African Americans have the crabs in a barrel mindset. They don't want somebody to get above them. And some of us still live within the confines of the slave mindset. Now, is it our fault? Yes and no. But the bottom line is we become very envious and jealous of each other. We end up wanting what the other person has. And sometimes we will lash out at another person as African Americans to make ourselves feel good. However, when it comes to, let's say, another community, I'll talk about the Caucasian community. You have some individuals in the Caucasian community who are extremely controlling. They want everything their way. They're very narcissistic. They're driven by ego, especially at work. They are driven by power. It makes them feel good, but deep inside, they feel poorly about themselves. But they want to utilize their power to make them feel above the rest of the individuals that they are working with. And at the end of the day, two things are going to happen. There's going to be a mutiny or there's going to be a mass firing. But when it comes to any of these personality disorders, I just used two examples. They can be detrimental to your health. And the bottom line is if you recognize any of the symptoms, you should get help. One of the reasons why people continue to live on with these disorders is just they don't seek help. They think they don't have a problem. It's just like an addiction. when a person continues to drink, it comes second nature to them. They don't believe they're drunk, but at the end of the day, they are. They just got immune to the alcohol and the substance, but they don't realize that they are hurting themselves. That is the same way when you have these personality disorders. Now, where do these personalities come from? Well, number one, they come from how you were brought up, because some of the genes are inherited from your family, which starts with your parents, or the environment you grew up. Because a number of us are products of our own environment, and we don't understand that. This is why we have different views of the world. Somebody who comes from the street, they're going to see the world differently than somebody who comes from the suburbs. But it doesn't mean that the person from the street is any tougher than the person from the suburbs. But it doesn't mean that the person from the suburbs is any smarter with education and credentials than a person in the streets. Because at the end of the day, they're both smart. But they have to utilize their situations to make themselves grow. And that is a big problem when it comes to us as African Americans. We keep comparing street and education, and we get nowhere. Because at the end of the day, it just seems like we don't like each other. It's not that we don't like each other. We don't recognize that a number of us in the African American community have mental health issues, but we fail to get them diagnosed. Now, some is due to the lack of resources, but a number of us in the African American community have always lived in denial, and we will always continue to live in denial. In fact, we're comfortable with being lied to. But really, the outcome or the root cause is not the ratchetness. It's not the attitude and the disrespect by people against each other. The bottom line, it's the mental health issues. And when we get those under control, and I don't care what community you come from, we can have a better society. I mean, you look at politics now. You got a lot of egos in politics. You have a lot of partisan politics, a lot of bickering back and forth. And when you have that, nothing gets done. And this is what individuals must understand when it comes to dealing with people, and particularly men. We are very competitive, and we let our egos out the moment we believe that somebody is trying to outshine us. Well, what we fail to do is take a step back and really look at the situation. And when it comes to women, well, you got a number of women trying to see who has more emotions than the other. And they don't get anywhere either. The bottom line, everything that I just presented to you, from egos to emotion, that's seen at the surface. What you want to get to is the root cause. And the root cause, I've just explained it to you. The root cause is the personality disorders, all 10 of them. Now, I will give you videos describing the 10 personality disorders. That way you'll have a better idea, because some of you may have some of the symptoms. I know I just told you I had a few of the symptoms of the obsessive compulsory personality disorder, because I was in the military. And the military is a very rigid type of platform or structure. Not everybody is built for it, because it involves a lot of discipline, training, taking orders, and leading. And it follows a lot of adherence to rules and policies. But at the end of the day, if you have a personality disorder, make sure you get help. Because the more you allow this personality disorder to win you over, it's going to take your life away from you. And what I mean by that, you're going to get into other disorders like anxiety, depression, which lead to stroke and heart disease, and that eventually leads to death. So do yourself a favor. If if you have a personality disorder. Number one, admit it. And number two, seek help. Because it takes more pride to seek help rather than to continue to live in denial. Because like Martha Reeves and the Vandellas said, you can run, but you can't hide. And that's my commentary for this edition of the 411 Talk Zone radio show for this evening, Monday, August 7th, 2017. You can tune into the 411 Talk Zone radio show every Saturday from 6 p.m. to 8 p.m. on Blog Talk Radio. Guest call-in number is 215-383-5785. If you like my videos, please share and subscribe to the 411 Talk Zone radio show right here on YouTube so I can continue to give you quality information for educational purposes from a professional and mature perspective. Now, on this channel, I don't engage in debates, controversy, or emotional issues, nor do I participate in drama and or unnecessary bickering. What I do on my channel is to teach, to give you the insight on different issues that are political, educational, career-oriented, and of course, the last 4 months, I've been doing mental health issues. Because at the end of the day, what I'm teaching on my YouTube channel is what all of us experience in real life. So, my job is to give you the information that I researched, and I'll give you my own personal experiences to share as well. Because, let me tell you this, not one of us is perfect. I've gone by and I've tried to do many perfect videos. I still have slip-ups. But that lets you know that I'm human. But as long as you listen to the message and understand what I'm conveying, well, it'll help you in the long run when it comes to understanding yourself as a person, understanding your flaws, because I have given you my flaws. And when it comes to any type of scholastic aptitude or having knowledge, just remember, when you have knowledge, you have power. And if you have a topic, a business, or a new YouTube channel that you would like for me to discuss on YouTube or Blog Talk Radio, feel free to email me at lej6521@gmail.com. And if you have a comment, please leave your comment in the comment section under the video. Make sure that your comments are pithy, no bloviating, pettifogging, or filibustering. Now, I'm going to issue this challenge out as well. If you have any symptoms of the personality disorders that I have mentioned, okay, when I do my future videos, list them in the comment section. I've already told you a couple of mine under OCPD when it comes to rules and regulations. So, be ready, because be honest with yourself. Be honest with me, you should be honest with yourself, because I'm going to be honest with you about my flaws, because I'm not going to deliver information that's going to be hypocritical. So I just want to put that out to everybody. And other than that, that's it for this video. Till next time, my name is Leon Jones. Remember, please be gentle and respectful to each other, and have a wonderful and blessed night. Good night.